Hi, this is Wally Taylor from Texas Integrative Wellness, and I want to answer a quick question that I'm asked a lot in my practice, and that's why is Lyme disease so controversial? I'm not a big fan of Lyme disease, the name, because it's really the name of a town in Connecticut, but it was a name given to a set of symptoms from the 70s where there was an epidemic in that community, which was subsequently shown to be, in many cases, associated with infection of a specific bacteria, which was a spiral-shaped or spirochete bacteria that was later named Borrelia burgdorferi. But the reason it's considered to be so controversial about Lyme disease is the fact that there are people that believe, that scientists and doctors that believe that that infection caused by that spirochete Borrelia burgdorferi is very easy to eradicate from the body with just a relatively short course of appropriate antibiotics, and that after that there should be no further infection, and that if there are still symptoms, then it must be related to something else. Sometimes it's considered to be a post-Lyme autoimmune type of reaction where the immune system attacks itself. I'd like to talk more about my opinion about autoimmune disease in an upcoming video, but suffice it to say, there are also a lot of doctors and scientists that now believe that once you're infected with the bacteria, Borrelia burgdorferi, that it's virtually impossible to completely 100% eradicate it from your body, and that it will actually remain in some capacity in your body. And it's the presence of the bacteria over time that gives rise in some people to many of these symptoms that we now associate with persistent Lyme disease or chronic Lyme disease, or these symptoms that persist beyond just the initial short period of the first, say, 2 to 4 weeks after the presumed infection, or when you actually contract the bacteria. It turns out that we see lots of patients in our practice that do have these infections with spirochetes like Borrelia burgdorferi and other germs that can cause disease. And actually, many of those patients are virtually without symptoms. And what we've come to learn is that different people have different sensitivities to the presence of these infections. Some people are quite resistant and don't seem to get symptoms, where other people are much more likely to be impaired or diseased as a result of the presence of these germs. But anyway, that's just a quick short answer of why it's so controversial, this controversy as to whether or not the germs can actually persist or not. In upcoming videos, I'll be able to explain to you just how these germs are known to persist. But anyway, if you like the YouTube, please subscribe to the channel, and I'd welcome you to share it with your friends and family, and come back to learn more about environmental illness and how you can help you and your family get over these illnesses and enjoy longevity and full, vibrant, and abundant life. So God bless.